Hello and welcome to IRACON 2023. I have with me today Dr. Srinivasan Venkatachalam, Senior Consultant Rheumatologist with the Royal Wolverhampton's NHS Trust Hospitals. He is in charge of the Rheumatology Clinic as well as the Osteoporosis Clinic at Cannock Chase Hospital. Sir, welcome to Hyderabad. Starting off on a personal note, could you just tell us your plans for your India visit this year?
Thank you very much, Shounk. Thanks for the opportunity. I think my main visit at the end of November is to sort of come and network at IRACON and meet young rheumatologists and try and see how rheumatology is growing in India.
Thank you for that, sir. And what do you find the most interesting aspects of our IRACON 2023 program this year?
I think the program is fully packed with lots of new ideas and things. But I think there is a platform for osteoporosis this year. And I think there are many pre-conference workshops which are very popular. And people are sort of taking it with the Indian data coming in many sessions and presenting.
Thank you, sir. So specifically going into osteoporosis, you have been taking charge of the osteoporosis special interest group meetings as well as the osteoporosis workshop yesterday. Based on that, could you tell us a few points of what you find the most interesting aspects of this disease, osteoporosis?
I think it's a very common problem, and I think all specialists need to be interested, and rheumatologists with a specific interest in some of the rheumatic diseases which are associated with osteoporosis and the use of steroids and the increased prevalence of diabetes in India. But we have to be pragmatic in our approach. So we need to sort of apply clinical risk factors which are widely available because we don't have enough DEXA facilities in the country. We need to use them judiciously. But it's good to see many treatments available here, but I think we need to use them appropriately for the right duration and then have a proper follow-up for the patients.
Thank you so much, sir. Talking about treatments, what have been some of the more recent developments in managing osteoporosis in the last couple of years?
I think the key paradigm shift in managing osteoporosis is if somebody is at a very high risk of fracture, is to move on to anabolic therapies, the treatments which build bone, like teriparatide, which is available here. And we use romosozumab in UK now, which will come here soon. But I think that is for the initial bit. And this has to be followed with anti-resorptives, like the bisphosphonates or denosumab. But we need to be careful about sort of how long we use them. And when we stop them, we need to be aware of the repercussions and the impact of the patients.
Sir, coming to the treatment and diagnostic paradigms, when I'm talking about an Indian scenario, what would be some of your takeaway messages for relevant diagnosis and treatment modalities in India in osteoporosis?
I think clinical risk factors like the FRAC score adapted to India with corrections for steroids, for vertebral osteoporosis, and falls. So that will be widely applicable. And only in a select number of patients, we need to use bone density. That's what would sort of be pragmatic in diagnosis. I think screening is not practical for a large population, and we don't do that in UK as well. But again, getting the right treatment, the right people.
Thank you so much, sir. You also have an upcoming lecture on the ever-increasing use of JAK inhibitors in autoimmune rheumatic diseases. These seem to be becoming more and more popular with rheumatologists nowadays. What is your takeaway message for us on that aspect?
I think it's a welcome change that we have targeted therapies available at an affordable cost for the Indian population of rheumatic patients. But only things I have a word of caution, it's like a double-edged sword. It has got its own risks. We have a large cohort of patients on JAK inhibitors. We did the initial trials there in UK, but you need to be wary of opportunistic infections like herpes zoster and complications of thrombosis and cancer. So we need to select your patients carefully, and only specialists should be using that. That's the key message.
Thank you so much, sir. Looking at a different aspect now, you have been shaping some training programs for rheumatologists in the UK. Given your experience working both in India and the UK, what are some of the key differences you'd like to highlight for us Indians to learn from or to improve our practice here?
I chaired the UK Rheumatology Training Committee for the last 5 years. I've been sort of teaching and training, and I've been looking at rheumatology training in different parts of the world. Having started my training initially here in India, So I think it's more clinical based with amount of clinical material what we have available there. But in UK, the training is more structured and we have more structured assessments, which can be sort of adapted for the Indian scenario here, rather than having sort of essays or other things, people moving into multiple choice questions for knowledge assessment. But the practical assessment, like we have workplace-based assessments. Like if somebody does a joint injection, we have directly observed procedural skills, clinical case-based discussions, or clinical assessments, which can be sort of adapted to the Indian scenario, which will help to try and sort of reduce the variations in training.
Right. And finally, on a lighter note, given that there is an increasing interest in young medicos taking up rheumatology, what would be your advice to all of us about maintaining a good work and life, professional and personal balance?
I think the future is bright for rheumatologists, but I think you need to draw a line, okay? It's not a competition. So who sees more patients in this thing? And I think you need to try and sort of have sort of a healthy balance, so that you need to draw, I'm going to sort of finish, I know to spend weekend with my family. And I think the patients will always be there. And I think there's no dearth of patients and people should not feel insecure. So I think relaxation, then you will go a long way. Otherwise, people can burn out earlier.
Thank you so much for your wisdom and advice, sir. Thank you for giving us your time. This is Shaunak Ghosh signing off for IRACON-TV. Thank you.
Thank you very much. Thanks for